The topic is spirituality, depression, and suicide, and we're talking to Dr. CPoe. Of course, Dr. Poe, during this last segment, let's give you an opportunity to talk about suicide and what we might be able to do in a real sense to prevent the prevalence of suicide. Certainly, we might not be able to stop it completely, but I think that you've indicated earlier that the statistics are going up on it, and so if we can do anything, that we might be able to intervene here.
Right. The prevalence rate of suicide in the U.S. is approximately 30,000 per year. That's true for about the last 10 to 15 years in comparison to homicide, which is significantly lower. In 1997, there were 21,000 homicides, 30,000 suicides.
So more people are actually killing themselves than people are killing one another.
That's correct. And it's also estimated that some of the homicides, some of the people who kill other people are really suicidal, because when a person is in despair, they're also in a condition of rage, and rage may go outward and or inward, all right? So some of the people who kill, it's estimated that they are suicidal. It's also true that some of the people who get killed, who are the victims of a homicide, it's also felt that in some cases these people set themselves up to be killed. They were suicidal. They chose not to take their lives directly, but they provoked somebody else into taking their life. Also, it is true that the suicide statistics are not accurate because suicides are often concealed. They are concealed because insurance companies don't pay for suicides, plus the fact that families don't want to deal with the shame and the embarrassment and the stigma of a family member committing suicide. So suicide is very prevalent. And it is also true that the suicide rate among our youth has gone up considerably. In the last 30 years, it's increased by 300%. Persons between the ages of 15 and 24. Also, the suicide rate among Afro-American teenagers is going up, especially between the ages of 15 and 19. So suicide is a real problem. It often occurs in clusters. You recall in Omaha, Nebraska in 1986, there were 7 suicide attempts. 3 of those youth, high school students, killed themselves. In Hickman County, I think it was 2 years ago, there were 13 suicides. In Blount County, where Maryville, Tennessee, near Knoxville, I think it was 2 years ago, a year ago, there were 35 suicides. I think these were among our high school students. Now, what they did, though, in these 2 counties, they developed a suicide task force. They decided to inform people to be aware of the warning signs. And by the way, let me say a word about that. One of the warning signs is a change in personality or behavior. The person